Hello, my name is Damlola Adeniji. My topic is Virginia Anderson need theory, and I'm going to incorporate it with patients with type 2 diabetes. And my place that is going to be focused on is in Nigeria. Virginia Anderson Principle of Nursing. Application of Anderson need theory into clinical practice by incorporating the nursing theory process in type 2 diabetes mellitus in Nigeria. Anderson focused on individual with crucial activity to maintain health, to recuperate or to have peaceful death. She proposed 14 components required for effective nursing care. Those components include breathing normally. With our diabetic patients with cosmal breathing, we need to watch their glucose level for them not to get to that point. We need to educate them to eat and drink adequately and not to avoid any foods that will cause hyperglycemia by eliminating by reducing carbohydrates in their food. We also need to um, tell them the importance of elimination of body waste. If they're constipated or have diarrhea, they need to know. We need to know so we can have intervention. Move and maintain desirable posture for any other disease not to take place. We need to be able to ambulate or move our body, turn and reposition those patients that are bedbound. We need to teach them the importance of sleep and rest. We need to teach them about selecting their suitable clothing, maintain their body temperature, keep the body clean and well groomed, especially their feet. We need to make sure that they are going to podiatrists to cut their nails so it won't affect or cause an injury to their leg. We need to avoid danger around them, especially tell them to wear those shoes so they won't have any cuts on their legs that will cause necrosis or that will cause them losing their feet. Avoid communicate We also need to tell them to communicate with their nurse practitioner or nurses about their health. Communicate anything they don't understand or they need elaboration on. We need to tell them they should feel free to ask. Worship according to their faith, work in such a way that there is a sense of accomplishment, play or participate in various forms of recreation so they are being engaged in activities around them, and they also learn and discover of safety, the curiosity to lead to normal development health and use the available health form. Conceptual relationship with Anderson theory. And Anderson theory includes physiological, psychological, and features of communicating and learning. Physiological needs includes glucometer, test strips, and alcohol swab, especially in patients living with diabetes in Nigeria. Most of them don't have this equipment. Glucometer is most of them never heard it before. So we need to actually show them and teach them how to use these tools. Psychological needs include lack of social and economical resources, meaning money. Money is kind of a major thing in Nigeria. When they don't have the money for the resources, then they can't really you can educate or talk however you want. But when they don't have the money to buy it, it's kind of your education is useless to them. So, individual in Nigeria with type 2 diabetes lack communication and resources to educate affected individual concerning the disease. Most of these people don't know what is going on. They when their healthcare provider just tell them, oh, you have type 2 diabetes, oh, you must eat some, don't avoid sugar, don't eat sugar. That's all they taught them. So they go home thinking I should just stop anything carbohydrates in total. So they end up eating one type of food every time. So we have to educate them that they can eating carbohydrates is actually okay, but it has to be in minimal term. Next is incorporating Virginia Anderson theory. She said something about some substitute. So nurse practitioner needs to provide free blood glucose screening for individual with type 2 diabetes at least 2 to 3 times a day. We need to teach them how to take their finger stick um daily, 1 to 2 times a day, to make sure that they're not hyper or hypoglycemic. Supplementary is educating this patient to for how to dress, to wear well fitted shoe, to check their body for any injury. Complementary will be educating patients on signs and symptoms of hyper and hypoglycemic, to teach them on how to intervene in one or the others. Or if your blood sugar is above 110, make sure you give yourself insulin, the sliding scale, all those things. Next is the major element: person, environment, health, and nurse. So in person, type 2 diabetes in Nigeria, we need to teach them about their mind and body, how to actually work independent, so they don't run to the nurse practitioner every time something happen. We have to teach them about their environment. We have to teach them about their health. Measure your blood. Don't only focus about your diabetes component. Make sure their blood pressure is okay. Make sure nothing else is going on in their body and their mind. um and nurses also have to teach them that it's okay to come and ask question, because it's they can't just learn all this in one day. We have to be able to engage. Say there's some other things that will question that doesn't occur to them, but as they get used to it in progressing forward, they have question. They have to be able to come to the nurse or the healthcare provider to educate them. We have to teach them to be independent. We don't want them to come to us to take their blood sugar every 3 times a day. So we have to teach them. We have to make sure that they understand, not only teach, understand, because some people, most people just nod, like, okay, yes, yes. And some of them also they have they are not educated, and our elderly, so we have to teach them that the numbers. We have to find alternative way to teach them how to maintain their glucose. um so Anderson advocates for to enhance patient independence to improve recovery. The theory argues for the provision of assistance to the patient to promote health autonomy. In regards to major element, the person, the individual who interacts with the nurse, the environment, location, therapeutic intervention, and health is the quality of life, while nursing is the use assessment diagnosis, making plans for care, intervening, and as well evaluating the patient in the individual for an individual. This brings me to the conclusion of my PowerPoint. I hope you enjoy it. Thank you.